Minnesota State Innovation Model, Practice Facilitation, Simple Data Collection. Effective data management. What's included? Identifying, collecting, analyzing, interpreting, and acting on data. Considerations to identify data. Identification of your data and your focus area is going to be a key part of your work. What information needs to be collected? You need to determine this, talk with the team that's identified, make sure you have all the members you need present. Then you look at what are the information sources. Where does your data come from? Is this going to come from formalized reports such as in Clarity Epic reports? Is it going to be a hand-gathered tally? Is it going to be a retrospective chart review, a concurrent chart review? What are your sources going to be? How should information be collected? What's your methodology? Kind of fits with the last question I was just talking about. You know, exactly who's going to do it, when is it going to be done? All of those pieces need to come into consideration. How much data should be collected? Is this going to be 1,000 patients over 6 months? Is it going to be one patient, 1 hour, one day? What is it going to be that opportunity for collection? How much do you need? And many people will talk about this differently. Some people believe it's 30 charts that you need or 30 opportunities. Some people believe it's a shorter 1 to 5, and some people say it's got to be 1,000. So talk about that and get it nailed down. And then what is your timeline? Start time, end time. What is the window? You need to consider that as well, because that will change how you look at data. A key piece of data is numerator and denominator, and many folks are not comfortable with what a numerator and denominator is. They don't know how to do it, but they're too embarrassed to say they don't know. So we're just going to call it out. As you can see, numerator is north, or it's on top, and the denominator is down or on the bottom. So use the N and the D as kind of your key. So you can see the explanation here as well. It says numerator, upper portion of a fraction used to calculate a rate, and the denominator is the lower portion of fraction that describes eligible population to be evaluated by the measure. We'll go on to the next slide, and that will give us a tell about how we can work with that further. So building a measure, numerator, number of cases observed that meet specified criteria, and denominator, sample of cases observed. So an example, we can use patients that have a diagnosis of asthma. That is sample of cases observed, or your eligible population. Your denominator is everyone who has asthma. And your numerator, or your top or north number, is the number of cases observed that meet specified criteria. So your criteria may be those patients that have a asthma control test done, or maybe those that have an asthma action plan documented. So it would be the number of ACTs, or asthma control tests, over all patients with asthma as your denominator. Process measure, numerator, denominator. Okay, so let's look at this. So the aim statement, by the end of quarter 2, increase to 50% the number of BMIs documented in the EHR for adult patients. Okay, so when we look at a measure, is the percent of unique patients aged 18 to 75. Those are the adult number that we've defined by our data measure, because every adult age limit could be different by your organization. So that's part of that data collection that we talked about. Who had a provider office visit during the measurement period, the defined time frame, the last 12 months, with a height and weight documented at the most recent office visit. So your numerator, of the patients within the denominator, patients who had a height and weight taken at the most recent office visit, and your denominator, or your lower number, the down number, is all patients aged 18 to 75 who had a provider office visit within the last 12 months. Percentage. This can be tricky for folks as well. Divide the numerator, or the north number, by the denominator, the down number, for percentage. So example, if you had 6 tests are up to date and the total number of tests is 10, what is the percentage? 6 over 10, or 6 divided by 10, equals 60%. We also, I pulled out the roadmap just to kind of let you have a visual for this. So you've set up a smart aim or measure, you've collected your data because you had previously identified it. Then you're going to show a display of it because visual displays and numbers are two good ways to show data to your audience. And then you're going to do an analysis, or what does the data tell us? So let's wrap this up. So when we look at this, numerator, denominator, we've got a smart aim. So we're going to do what by when, so you can kind of see the layout there. You've got your numerator and denominator, or your north and your down or your lower number. And what are you measuring? You're going to bring in process mapping and plan, do, study, act, or small tests of change as well. This is simple data. You've got your numerator, denominator, and you're going to do what by when.